Hello and welcome to episode 11 of the Equity Plus podcast from CareShare Health Alliance, where we take a deeper look into issues surrounding health equity. I'm your host, Erin Story, Director of Communications here at CareShare. I am so excited for today's episode, where we'll introduce our newest addition to the CareShare staff, our Medicaid Expansion BIPOC Community Engagement Coordinator, Shakira Greene. Shakira is going to tell us about her role helping CBOs serving BIPOC populations host enrollment events to get more people connected to Medicaid Expansion. She'll also tell us about how her background in healthcare led her to being passionate about health equity and affordable healthcare for all. So without further ado, let's hear from Shakira.
Hi, I'm Shakira Greene, and I am the Medicaid Expansion BIPOC Community Engagement Coordinator.
So, Shakira, can you tell us about what Medicaid Expansion is and what changes have been made to make more people eligible for Medicaid?
Sure. So Medicaid expansion is where it's essentially been expanded or offered to more North Carolinians. Before, there was limited benefit and limited enrollment. It was not offered to the entire population. You had to have like maybe a disability or be pregnant, and there's some other qualifications as well. Now, any North Carolina resident between the ages of 19 through 64 years old that are at or below 138% of the federal poverty level with an eligible immigration status are now eligible for Medicaid.
That's absolutely right. Medicaid expansion is a great opportunity for more people to get affordable comprehensive health coverage in North Carolina. We also encourage anybody who may have applied for Medicaid before and been denied to go back and apply to see if they're now eligible under these new guidelines. Okay, and Shakira, I know that we have talked about your passion for Medicaid expansion and the work that you have done in the past to promote it. Could you tell us a little bit about yourself and what it is that makes you so interested in promoting Medicaid expansion and affordable health care?
Sure. So I've worked in healthcare for, I guess the past 20 years. And I have just always had a passion for community health and working for the people and those that are in underserved communities. And I have worked with several organizations, and I am a part of several groups that have advocated for Medicaid expansion for quite some time. As a matter of fact, I met with legislators in Raleigh and participated in various efforts to expand Medicaid when the Affordable Care Act first went into effect. So well over 10 years, I've been working to promote Medicaid expansion. And I'm really passionate about this because I believe that everyone should have access to health care. In this country, with all the resources that we have, I just don't believe that we should have people that die from preventable illnesses or diseases. So, for both professional and personal reasons, I am extremely passionate about Medicaid expansion and getting the word out and trying to get as many North Carolinians signed up as possible. And I am a recent med school graduate. And as far as my goals in that regards, I hope to go on and work at a federally qualified health center because again, that population just really resonates with my spirit. I just feel really passionate again about providing health care to those who need it the most. I do have plenty of stories of people who would have benefited had we expanded Medicaid like so many other states did sooner than later. One that comes to mind that just really touched me was a young lady that was a patient of the healthcare practice, OBGYN practice that I worked in before. And she was, I want to say she was 33, maybe 33, 34, but she had gone to the hospital on, I believe, 2 occasions with some discomfort and pain, GI discomfort and pain. And she was referred to our practice. And we saw her and decided she needed to have a gastrointestinal consult, that we determined that it wasn't female related or women's health related. And so it took me like 2 months to call around and beg to get someone to see her. And the unfortunate thing was, okay, she was working. The woman, she was employed. She had 3 children, but she didn't have insurance. Now, she would pay her bills. She was self-pay, but I couldn't find anybody that wanted to see her. So I finally got her in with I spoke with an office manager, and I was finally able to get her in, and I told her how much she would have to pay up front, and she paid the money. She paid it. And it turns out she had stage 4 colon cancer. Well, at that point, they were able to get her on Medicaid, but unfortunately, I think she lived maybe another year, and then she passed. Now, this is a story of a woman who was hardworking. She went to work. She worked up until when she died, from what I understand. She did not have insurance, and so nobody wanted to see her. And had she had full coverage Medicaid, we absolutely could have gotten her in somewhere sooner. And perhaps this would not have been the outcome, because the time frame from when she first presented to the hospital to the diagnosis was nearly a year. And I have a story of a relative. He was 36 with hypertension, and he used the hospital to manage his care whenever he got headaches. He was working full time and could not afford insurance to, buy it on his own. If he had paid for insurance, he would only have roughly $100 a month for his family. He had 3 children and a wife. So he chose to forego insurance to be able to take home all of his paycheck. And he died at 36. His youngest child was 6 months old due to complications of hypertension. Hypertension medication is as cheap as $4 for a month subscription now, but he couldn't get in with the doctor's office because, unfortunately, some doctor's offices won't see you without insurance. And then if they will see you without insurance, the cost is so prohibitive to be seen. So all he needed was a $4 prescription, but he couldn't get that because he couldn't be seen. And I know of other stories too. I could go on and on of people who could have been saved from Medicaid expansion. So if I know of several lives that have been impacted negatively from not having access to care, just think about all of the people that we are going to be able to help with Medicaid expansion. We're going to save a lot of lives.
Thank you for sharing those stories, Shakira. And I think you're so right. I think we are going to be able to save a lot of lives of people who are in similar positions with Medicaid expansion. Now, I wanted to talk about your role and the reason that we have a coordinator position specifically for BIPOC populations. Can you tell us how BIPOC populations in North Carolina are going to be specially affected by Medicaid expansion?
So, BIPOC communities tend to suffer from health disparities, in particular with chronic illnesses such as hypertension and diabetes. And a lot of times we see that they present late in illness. And when you present late, that usually leads to more morbidity, mortality, and it's more expensive to treat at that point. With Medicaid expansion, having this earlier access to care, hopefully with the BIPOC communities, we can find a way to stabilize, so to speak, their health and try to maintain health and reduce some of the health disparities in the population. And what we're seeing now in enrollment is a real opportunity to engage the BIPOC communities, because we don't have as many people enrolled as what we would like to see. And that's what I hope to do in my new position. I hope to really target that population and try to increase the enrollment.
And we know that you're going to do an amazing job with that. I also wanted to add that there was in 2022 a report from the Urban Institute that looked at North Carolina and what the uninsurance rates would look like if Medicaid expansion were passed. And they stated that the group that would be most affected by Medicaid expansion as far as lowering the uninsurance rate would be Black North Carolinians, which is one of the reasons that we have the BIPOC coordinator position, because we want to make sure to reach out to that population that would benefit so much from Medicaid expansion. And of course, as part of your role, you're helping community-based organizations set up enrollment events to help people connected to Medicaid expansion. Can you tell us what it would look like for a community-based organization to work with you to set up an enrollment event?
We're working with community-based organizations that primarily serve the BIPOC community. And in working with these community-based organizations, we will assist them in hosting enrollment events to connect the BIPOC community to Medicaid expansion. As I mentioned earlier, there is a need for increased enrollment in this population. So we would host events or assist them in hosting events that may look like health fairs or events maybe at their church, if their church has like a regional or district meeting, something like that. If there's like festivals that are going on, something of that nature, we would be able to support these community-based organizations. And during the events, we would have navigators, what are called navigators, to assist with enrolling folks in Medicaid, or well, of course, first checking their eligibility, and then if eligible, enrolling them. And we would have a staff member from CareShare Health Alliance. Most likely, if it's BIPOC, it would be me. And I would be there to explain Medicaid expansion and what it means for our community.
So, Shakira, can you tell us how someone can get in touch with you if their organization would like to host an enrollment event? And what are the resources that CareShare can help provide to those organizations that like to host the events?
Thank you for asking that question, because I am looking forward to hearing from lots of people in regards to what we can do. So my email is, it starts off like my name, S Greene. So SGREENE at caresharehealth.org. And my phone number is 336-880-1567. And I would say with the phone number, it's best to text me. And as far as what we would be able to provide to help with an event, we would be able to provide support as far as planning an event, promotions, and we also be able to provide a small amount of financial assistance to host the event itself. So those are some of the different ways that we're able to assist with events as far as helping with community-based organizations. We can also serve as sponsors, co-sponsors, or even a vendor at an event, because it's really important to us to try to get the word out about Medicaid expansion and reach all of the people across North Carolina who are eligible. And one thing that I didn't mention before is that I am able to provide support across the state. So it's not just any one particular region. We will be working with people and community-based organizations all across the state. So if you have something going on, please feel free to contact me. And no event is too small, because if we can get one person enrolled, it's worth it.
Thank you for listening to this month's episode of the Equity Plus podcast. If you'd like to know more about CareShare's Medicaid expansion work and how to get in touch with Shakira, visit our Equity Plus network at equitypn.org. Shakira's position is generously funded by the NC Justice Center. If you enjoyed today's episode, don't forget to subscribe to hear more from community leaders and community-based organizations in North Carolina about how they're working to advance health equity. To learn more about CareShare Health Alliance, visit us at caresharehealth.org, and don't forget to check out our hub for community-based organizations working to promote health equity and community voice, the Equity Plus Network, at equitypn.org. That is EQUITYPN.org.
We can't wait to connect with you there.